In the next section, we'll move on to the drug management of obesity. Drugs for management of obesity. Now, it is often a stigma to use drugs for management of obesity because people feel that somebody who's using drugs is not adequately motivated for exercise or diet restrictions, so that is why he's moving on to drugs. That's not entirely true. The concept of biological defense thresholds. That means when you tend to lose weight, your body tends to oppose the weight loss significantly. So there is a threshold below which it is not easy to lose weight in spite of your extreme physical activity and exercise. Such patients often need medical help for the management of obesity. Now, obesity has to be looked up as a disease. Diabetes is a disease, hypertension is a disease. In the same way, obesity is also a disease which has to be managed long term. Some of these people, in fact, require drugs in the long run for management of this problem. Endocrinologists and a lot of physicians who manage obesity are well equipped with newer drugs which manage this disease very effectively. The most famous of these drugs now are what are called as GLP-1 analogues and dual-incretin analogues. Ozempic, which is semaglutide, has become quite a famous drug world over for management of obesity. So how do these act and why is it important to know about these drugs? So they have 4-axis action plan when it comes to the mechanism of action of these drugs. The first one is central appetite suppression. So it acts on the central receptors in the brain to reduce the appetite. The second one and the most important one is delaying gastric emptying. So the stomach emptying is delayed significantly, leading to stasis of food and a sensation of fullness which decreases the appetite. The third one is the magical effects of this drug on the pancreas. Now, pancreas is often an important metabolic organ because it releases the insulin and the glucagon. These drugs cause the pancreas to release insulin only during the glucose surge. That is, a glucose-dependent insulin release is enhanced by these drugs. On the other hand, the glucagon secretion is suppressed. So both of these produce the best metabolic advantage. The fourth effect of these drugs is increasing the lipolysis or the fat burn. Who are the candidates who benefit from these drugs? These drugs are indicated only in 3 specific situations. If your BMI is more than 30, if your BMI is more than 27 with diabetes mellitus, or if you have a non-alcoholic fatty liver disease. So these are the 3 situations where currently this drug has been approved for management. It is also important to understand that use of these drugs alone is not sufficient for management of obesity because proper exercise, dietary precautions should still be continued along with drugs for getting the maximum advantage out of these drugs. These drugs, when initiated, often cause almost 20% weight loss in individuals. The key is not just initiation of the drug, but the maintenance plans. So the endocrinologists often use these drugs in 3 phases. The initiation phase, where the dose is slowly escalated to look for the side effect profile. The maintenance phase or the active phase, during which the maximum weight loss advantage is gained. Third phase, during which the dose is reduced and kept at a steady state to maintain the advantages that have been gained. But remember, these drugs should be taken in a proper medical supervision. Significant complications include extreme risk of vomitings, retching, sometimes pancreatic problems are often seen in some of these individuals. The side effect profile of these drugs also includes pancreatitis, gallstone disease, and risk of thyroid cancers. So use of any of these drugs without a medical supervision is forbidden.